This is Jennifer Mugnier recording the PowerPoint for MSN 6007. This is documentation, medical record, and DART charting with Loretta Jones, RN, MSN, FNP. What to document? Assessments, diagnoses, outcomes, interventions, patient responses. Good documentation is concise, accurate, complete, legible, timely, and logically organized. Legibility means it's legible in black ink, you write neatly, and always question and clarify illegible writing. Signatures. Sign document using your first letter of your name, the last name, and then the title. So an example is N.Nurse, USASN. Never sign anyone else's entry. Correcting mistakes. Do not use whiteout. It should not look like data was hidden or tampered with in any way. A late entry. Every organization is going to be different. A late entry has a date and time or an addendum. Don't try to squeeze something in. From a legal standpoint, if you didn't chart it, it wasn't done. Conciseness. Use standard approved abbreviations. Document according to the unit's protocol, such as every 15 minutes, every hour, every 4 hours, etc. Considering others. Never write critical comments concerning others, such as Dr. So-and-so made an error in orders. Report threats of legal action or bodily harm from the patient or family to any healthcare personnel involved with the patient. How not to chart. And one of the examples is, by the time he was admitted, his rapid heart had stopped and he was feeling better. Another example is healthy appearing decrepit 69-year-old male, mentally alert but forgetful. The next example is the patient refused an autopsy. The next example is large brown stool ambulating in the hall. Another example, the patient had waffles for breakfast and anorexia for lunch. The patient expired on the floor uneventfully. Next is, since she can't get pregnant without her husband, I thought you would like to work her up. The next one, patient has 2 teenage children but no other abnormalities. Focus charting. DART versus SOAP notes. DART stands for data, action, response, and teaching. A SOAP note stands for subjectively, objectively, assess, and plan. Data. Data is subjective data, anything the patient tells you. Use quotation marks, such as the husband states. It can be obtained from family members and other members of the healthcare team. Observations of an event in progress. It can be reproducible. Objective data are observations you make about your patient. The physical assessment, the lab results, observations of an event in progress, which are not reproducible. Examples, descriptions of events, such as an EKG, telemetry, family at the bedside, behaviors of visitors, or a patient smoking. Non-nursing actions, discharge planner in, dietitian consulted, insertion of arterial line. A is action. This is time-sensitive interventions or action based on assessment information. Response. The result of nursing or medical intervention or action. It can be immediate, delayed, or progress towards a goal. Teaching. Teaching the nurse does that is related to the problem. Teaching performed by the nurse, other healthcare professionals, results compliant or non-compliant. FYI, every action needs a response. You may not always use every letter. Stop and practice now as a group activity. An example, we have the date as April the 5th, 2010. The time is 8 o'clock. The focus of this note is pain. So in this one, it appears that in the Dart note, we're only going to use the A and the R.